David, thank you. The Biden administration wanted to start administering booster doses of the COVID-19 vaccine next week, but the FDA has other thoughts. Health officials say that their primary concern right now is getting people in for their first and second doses rather than their third. John Lawrence reports.
Vaccine advisors to the Food and Drug Administration have voted to recommend emergency use authorization of booster doses of the Pfizer vaccine for people 65 and older and those at high risk of severe COVID-19 6 months after they received their first shots. But they didn't approve booster doses of the vaccine for everyone 16 and older, citing a lack of data about the safety and efficacy of a third dose.
They did make a more conservative decision than I anticipated. But this is an example of science being out there and good-hearted, well-intentioned, smart people debating how to turn that science into public policy.
The Centers for Disease Control and Prevention makes the final decision on the shots. The agency meets its vaccine advisors next week. But booster shots aren't the key to turning the pandemic around, according to officials and health experts.
What is going to be the change in the arc of this pandemic by giving a third dose to people who are already vaccinated, as compared to giving 2 doses to people who are unvaccinated?
In the meantime, COVID-19 cases are still overwhelming many hospitals nationwide.
There are often procedures that are time sensitive, that need to get done that are being delayed longer than we would typically like because we don't have the inpatient capacity across the state.
I'm John Lawrence reporting.
The federal government is investing $2.1 billion into preventing future epidemics. The funding will come from the massive COVID-19 relief bill signed by President Biden earlier this year. It will be used to create and train strike teams. Now, those teams will help facilitate with known or suspected COVID-19 outbreaks. Funding will also go towards research and training on new ways to control the spread of infections. The number of people hospitalized here in Indiana with COVID-19 is 2,507. That's down from 180 since Monday, but nearly 1/3 of all ICU beds are being used by COVID patients, and that's putting people in need of other treatments at risk, those who suffer heart attacks or strokes, for example. Dr. Graham Carlos, chief of medicine at Eskenazi Health, expressed his concerns.
I worry for all those people who have problems unrelated to COVID, who need hip surgery or have a heart attack or stroke, and there may not be access. I was reading a story just now from a hospital review email I get, and the title, Mary, was heart patient dies after being turned down from 43 ICUs amid COVID-19 surge.
Carlos says the patients he's seeing are either unvaccinated or people who have had COVID-19 and don't see the need to get the vaccine.